Welcome to Unity with Pam, with your host, Pam Willis-Hovey.
Mr. Care, we have a representative coming forward. The person on the program can't make it, but I thank God for people who send in fill-ins. I appreciate that. Thank you, Ms. D.
Good afternoon. I am Dee Simmons. I'm one of the admissions coordinators with Vista Care Hospice. I have been there approximately 7 years. I have a nursing home background, which kind of transitioned me right into hospice, because some of the same people you have to talk to and present your services to, they do come from the nursing home, and then they transition into hospice. A lot of people don't like to hear the word hospice, and I think it's because a lot of people just truly don't understand what hospice is about. There are a lot of myths out there about hospice. Some people have called our office and basically said, I only think hospice is for people who are dying of cancer. But there are so many diseases out there right now that that hospice can provide service for that people aren't aware of. And I am generally one of the first contacts when someone called in. I'm there from Monday through Friday from 8 to 5. And I truly tell family members, if you have any questions about hospice and want to dispel some of the myths that's out there, please call and get some good information out there. Hospice is covered 100% by Medicare. A lot of people are not aware that you do have a hospice benefit attached to your Medicare. Also, Medicaid also has a hospice benefit, and most insurances do have some type of benefits that someone can get some services for hospice. We also do take non-funded patients because we know that, and a lot of people realize, what a lot of people don't understand, the population, because our population now, hospice patients, are between the ages of 45 and 55. And I know that's real hard to hear right now, but we have a lot of sick young people out there. And a lot of those people are working age people that have lost their insurance because of the disability, not being able to work, and they don't think there's anything out there for them to receive because they don't have the monies or the insurance. And that's another thing that we're trying to get the word out there, because, we are a young population because we are a military town, and a lot of those are coming through from the military effects or things of that nature. So, and I just want to let you know, there's a little thing, if you have access to a computer, we do have information that you can go in and research on the computer. We have 2 websites. Right now we have VistaCare, www.vistacare.com, and we also have Gentiva.com, because we are part of Gentiva, and some of you may have heard of our home health division, Gentiva, but we will be acclimating ourselves into that name for the community. But that information is online. I have left some information out back also, and some of the things that you and so the information is out there, and it's a pretty simple form you can fill out. If you have any additional questions for this information, our phone number and our address, I'm going to leave some of these out there at the front. Our mailing address is there. Mail it in to me, call me, go over it with me over the phone. I'll be more than glad to answer any additional questions that you may have. And I do want to thank Pam for allowing me to have this opportunity to come out to speak to you and tell you about hospice. And thank you again.
Okay, Better Way Foundation. My brother, my partner, I love him so much, Mr. Jeremy Hobbs, and Miss Tan. She's also a local book author. Dynamic duo.
Thank you so much. Let's give Pam a big round of applause for all she does for us. First of all, thank you so much for having me here today. I'm Jeremy Hobbs. I'm the president of the Chattahoochee Valley Better Way Foundation. This young lady at my side, after last night, long deliberations and everything, is now our new vice president of the Better Way Foundation as well. Let's give her a big round of applause. And she's also our public relations director, so please be sure you get to know her today, talk to her if you need her to come to an event, and talk to anything about HIV, AIDS. She's also an esteemed author and my best friend, so I'm glad to have her here with us. My card is out there on the front table. We help over 1,600 people locally living with HIV and AIDS right here in the Chattahoochee Valley. If I myself am living with AIDS, my secretary here, Glenn Smith, let's give him a round of applause too. We're both working hard. Last night, Tan got to set in on an actual support group and see what we actually talk about. We don't talk about just CD4s and viral loads and all this other stuff. We talk about life. We talk about molestation. We talk about everything that goes on in our lives to make and help pave a better way of life for you. And that's exactly what we do here at the Better Way Foundation. We've been out there for, this will be our 5th year, and we are just making waves everywhere we go. I'm so proud of all the the community support that we receive every day. And thank you for coming out there and being a part of it. And thank you for getting out there and getting the word out about testing. The most important part, prevention. I think you just heard about a baby that was cured. Make sure you get this in your heads. That is a functional cure. What that means is the child still has HIV antibodies in their body. However, at this time, they don't show any traces. So, let's all be pushing towards this cure. Thank God for that. Let's give God grace for that, ladies and gentlemen. Amen. And ladies and gentlemen, I want to turn it over to Tam because she's going to talk about our upcoming event that she's going to be doing. But remember, May 19th at the Candlelight Memorial from 4 to 6 p.m. at the Columbus Government Center. See me. Thank you.
Hello, everyone. My name is Ms. Tan, and it is an honor, actually, to be able to embark upon this position. And the reason why I did, paving a way. So you will be seeing a lot of us, walking around the Columbus areas. I would like to go into more of the desolate areas of town to actually get the information out. So definitely look forward to seeing us. June the 29th is a tentative date that we're doing $1 to pave a better way. And what we want to do is get the whole entire community to come out and just give $1. Get the children involved as well, 25 cents a week. We're going to kind of make a very small increments for a very large cause. And I look forward to definitely serving this community under the guidingship of Mr. Jeremy Hobbs. And I do love Miss Pam. Oh, my God. I love you so much. So once again, my name is Miss Tan, and it is an honor to be in Columbus, Georgia, to be doing such a great cause for HIV/AIDS.
Unity with Pam is being brought to you by these great sponsors.
Come into Chester's Barbecue for our world-famous mouth-watering ribs, smoked fresh on our grill daily. Or try one of our barbecue pork plates with fresh sides. Chester's has delicious sandwich combos to choose from that are sure to please. We also serve tempting home-cooked favorites. And don't forget to take home your own bottle of great sauce. Chester's Barbecue, serving the best food at the best price, with 3 locations to serve you.
You love your parents, and it's hard to see them struggle to keep their independence. Magnolia Manor can give your parents the assistance they need to enjoy life. You won't have to worry if they are eating well or taking their medications properly. And they'll be in a safe, secure environment with no need to worry about cleaning house or doing yard work. Visit magnoliamanor.com to learn more. Magnolia Manor, just down the road. A community of convenience, caring, and fun.
My name is Japal. 2 years ago, I received a kidney transplant. When I was 21 years old, I started dialysis, and for 7.5 years, I was a patient receiving treatments 3 times a week for 4 hours each session. And man, it was hard. After receiving my kidney transplant, I was able to find and marry the love of my life. My kidney transplant gave me my life back.
You have the power to donate life. Be an organ, eye, and tissue donor. To find out how, go today to donatelifegeorgia.org.
Dr. Ephraim Eldridge's office. Dr. Ephraim Eldridge is not with us, but he sent his best wife, only wife, cute wife. And he said best wife, only wife, cute wife. Been knowing her since I was, can I say, is it all right? I've been knowing her since I was a little girl. And I turned 40 in September. Lordy, Lordy, big girl gonna be 40 this year. Woo! And I'm calling up Miss Pat Eldridge. Somebody said I'm going to stop telling my age. Not.
Good morning, good afternoon, whichever you desire to be. Thank you, Pam, for inviting me this morning. I really appreciate it. And thank you all. Gosh, there's so many people here. It's amazing. But anyway, I am from Dr. Ermina H. Eldridge Jr.'s office, and I have known Pam for a while. When we first moved to Columbus, she was babysitting my children. So now I'm helping her. I hope this helps her in her endeavor in allowing the community to get information. But anyway, this morning I'm going to talk to you about making the most of your health care visit. Now, we've heard Ms. Gwen from Trinity. We also do OBGYN, but that's all we do. So we are strictly women's health. And so we want to make sure that all women are taken care of. Now, we see women who have insurance, and those women who do not have insurance. If a patient has been with us before and they no longer have health insurance, we will then see them as well. So there are all types of ways out there to get your health taken care of. But what I want to say, and hopefully this won't last too long here, and I know this guy right here will tell me when my time is up. But first of all, I want to say making the most of your health care visit. To achieve the best health, you need to be an active member of your health care team. One way to be involved with your health care is to provide and prepare for an actively participation in your visits with your health care provider. This fact sheet outlines steps you can take to get the most of your health care visit. First of all, you need to make an appointment. And when you make an appointment, be clear about why you need to see the health care provider. Do you need an annual checkup with your regular health care provider? Is your visit about a new problem? Be sure to say whether you need to see the health care provider right away if you have an urgent problem. Is your visit to see a specialist? And we are considered a specialist, but for women's health, we are considered a primary care. So you can come to us for your annual visit. Now, if you have a policy that says you have to see a specialist, you do have to check with that policy first. But for everything outside of that annual women visit, you will have to check with your insurance. But we are considered both, so it's kind of a dual role we play. If you are seeing a new health care provider, find out whether he or she accepts your insurance plan. Bring your insurance card with you when you come to the visit. It is absolutely imperative to do that. And he's telling me I have 1 minute. Okay, so I'm gonna speed this up. Before you visit, prepare yourself. What you want to do is you want to list all your questions. Make sure you bring your questions with you when you come to the doctor. Write down your signs and symptoms. I don't have that much time to tell you how to do that. You want to give a complete health history. You want to bring your past medical records. That's so very important. Make sure you do that. You want to think about bringing a support person, because sometimes people zone out when they're not being told everything they want to hear. So you want somebody there with you to make sure that they have those hearing ears too with you. You may have a physical exam. You want to bring a list of your medications. Please, please, please bring every list of medication that you take, because we want to make sure that we are not giving you something that you're already on and that it's not going to hurt you when we bring you on something else. So make sure that you do all that. Now, I'm going to stop. There are a lot more things that I can tell you, but all I want to say is that please, please, please have your annual health checks. It is so important. We want to make sure that we have a healthy lifestyle. We want to prevent cancer. We want to get rid of all these things that are out there, heart attacks, strokes, all of that. If you do that, have your annual health care, take care of your body, exercise, drink a lot of water, eat healthy, and we'll have a really good, healthy lifestyle. So thank you so very much. I appreciate it.
Columbus Home Medical Equipment, Ms. Sharon Story.
Good afternoon. I'm Sharon Story with Columbus Home Medical. We are actually a new company. We're locally owned and operated, Chuck and Jenny Nobes. We're at 1711 Warm Springs Road. We carry hospital beds, oxygen, wheelchairs, walkers, diabetic shoes. If you aren't able to come to the store, if you call us, we'll actually come out to your home and help you with that. We do the extra. We know there's a lot of elderly people that don't have families. If they aren't able to take down equipment or move equipment to make room for their new equipment, we actually do that for them at no charge. We do try to do the extra for them. So I hope some of y'all will call us and ask questions, and we'll certainly be there to help you. Yeah, we have a joint. We have Synflex. It's a joint that you drink. capful in the morning and capful at night. It helps aches and pains, arthritis. I actually take it. I've been taking it for about 8 weeks, and I do feel a lot better, so it does work. We have brochures on it if you'd like to stop by our office or call me. We have support stockings. I mean, we pretty much carry anything that you need. We're a one-stop shop. Thank you so much.
West Central Georgia Cancer Coalition, Ms. Cheryl Johnson.
Good afternoon, everyone. It is, wow, I was sitting in the front and I didn't realize how many people were in the back. Wow. But for those of you, the West Central Georgia Cancer Coalition, we are a nonprofit. We're a very small nonprofit, but we do a large impact in the community. We service men and women that are uninsured and underinsured, and I know we hear, a lot about the insurance plans and so forth. But we provide screenings for breast, colorectal, prostate, and cervical cancer for women, those that the women will meet. And prostate, we get them connected for men, get them connected to the services that are needed. But we are a community we work with all of the hospitals. St. Francis, they're our partners. Columbus Regional are our partners. Valley Healthcare, they're our partners. So we partner with all of the healthcare providers, Dr. Eldred's office. We partner with the healthcare providers to connect the patients that are uninsured to the services that are needed. For instance, if there's a woman who needs a mammogram, she doesn't have insurance, or she's underinsured, because if there's a $5,000 deductible that you have, you're not thinking about getting your mammogram done. And so we're that entity that will help that woman get to the services to diagnosis or non-diagnosis. We also fill the gap. There are women that are 25 who may have a history of breast cancer, mother, grandmother, and the list goes on. If she finds a lump, then she can call our office and we will get her connected to the medical provider that will get that clinical breast exam done, get the order for the mammogram, and then go on to get the services that are needed. But we do have a navigator, and that's Carol Hall. She connects them, walks them through the process to whatever the services that are needed. And so we also have community health advisors, and one of our community health advisors is here, Miss Laverne Jackson. You all probably remember her from the John B. Amos Cancer Center. Well, she retired and we grabbed her. So she's helping us out tremendously. We do have a table in the corner, and if you'll stop by and get some information on that. We serve 13 counties. We cross over. We serve Chattahoochee, Harris, Marion, Meriwether, Muskogee, Sly, Stewart, Talbot, Taylor, Troup, Webster, and we also service Lee and Russell County. We're the only entity in the community that will go across the river to help those women in Lee and Russell County that are needing those services. We, if someone has a risk of cancer, need more questions, need information about that, we are here to reduce the burden of cancers in the communities that we're served. We are truly neighbors helping neighbors. If you'd like more information, please stop by. It is March. March is Colorectal Cancer Awareness Month. So we ask you, if you are 50 and older and you have not gotten your colonoscopy, please do so. We have information about that as well. Thank you.
Bradford Health? Oh, okay. Angie Capella. I'm looking all over. Sorry, girl.
Thanks, ma'am. Good morning or good afternoon. I'm Angie Kopek. I work with Bradford Health Services, and we specialize in drug and alcohol treatment for adolescents and adults. So here in our community is that it has become quite a big epidemic, not just here but all over the United States. What we do at Bradford is we try to provide as much help as we can, not just for that potential patient, but also for the family. So first off, we have free family support every Thursday. It's a meeting from 6 to 7 at our facility in Brookstone Center, just off of Bradley Parkway. And then from there, also, if you call, we are open 24 hours a day, 7 days a week, and we offer free consultations. So our biggest thing here in the community is for us to be able to help that individual that has a drug or alcohol problem. A lot of times is that we don't want to look at what is going on with our loved one or friend, sister, brother, mother, or whoever. And it's really important is that we're only keeping them more and more unhealthy by not doing so. All of our staff is trained. Majority of the people that work with Bradford are in recovery themselves. So there's a lot of heart and soul that goes into this, and anything that we can do, all you got to do is pick up the phone and call. So if that's providing AA or NA meetings, needing additional information, or if it's us just referring you to somewhere else, our gig is to get you help ASAP. So with that, I have very exciting news in the fact that on March 29th, we will be moving to a new building. So we are located over in Brookstone Center. The trick of it is we're moving a building up. so I guess we'll all be carrying boxes to our building. But it's going to provide a lot more space. So additional education programs, additional things that we can do within our community. You guys, please check us out around the end of the month. Just to even come and see what we have to offer there. But we will be located, our new location is going to be 850 Brookstone Center Parkway, Suite 100. We're 860 right now. So very close. But anytime that you need anything, 24 hours a day, 7 days a week, I've got additional information up here, and you can always look online or call our number, 706-649-3075. And thank you so much.
Unity with Pam is being brought to you by these great sponsors.
When you've been hurt in an accident, it helps to have experienced and knowledgeable attorneys to help you in your time of need. For over 30 years, our office has been helping victims in auto and truck accidents or with work-related injuries. We resolve thousands of cases both in and out of court. So if you've been hurt and it wasn't your fault,
talk to Walt.
Talk to Walt. Talk to Walt.
Talk to Walt. For your free consultation, call today, 1-855-GO-ASK-WALT.
For more than 60 years, the Dairy Queen recipe for success has been simple. It's been a combination of hardworking people, great tasting food, and tempting treats served in our establishments every day. Although a lot has changed in 60 years, some things remain the same. The smiles on children's faces, a treat for a good report card, close friends enjoying a great meal, and families spending quality time together. Here at DQ, we are always committed to treat you right.
Local Church Connection is an exciting new publication in the Columbus area. Local Church Connection is a magazine that offers free advertising to Christian churches. Our circulation is 10,000, and we're free to pick up at over 100 locations in Columbus, Harris County, and Phoenix City. Be on the lookout for our new March-April edition of Local Church Connection. For business or church advertising, contact Tricia Jeems at 706-244-6413 and check out our website at localchurchconnection.com.
Welcome you to be a part of our ministry. This is not a put on, but this is a come on. And we come to share in our different ministries with our dance team, with our choir, and our TV ministry. And we're looking for great things to happen, great miracles to happen within this great thing to happen, great miracles to happen within this place. Come and be a part of the blessing plan.
I have a massage lady in the back that you definitely need to benefit from. She has a chair set up in the conference room, and she's right in front of my face. I'm going to let her tell you a little bit about it. Reason I didn't say her name because I just couldn't get it right, so I'm going to let her do it.
Good afternoon, everybody. It's a pleasure to meet you all. My name is Silhouette Jones. I own a company called Celestial Azul. We're a holistic massage studio. Holistic medicine is starting to make its trend currently in the medical field. Holistic medicine deals with natural ways of being able to heal the body, and massage is definitely one of those ways. I have brought some flyers here today, and this here is one of my therapists. Her name is Laverne Alfred, and we will be over here in the conference room doing 10-minute chair massages, and I will also be doing Reiki energy work on people. I'm not sure how much people know about Reiki energy work, but I'll talk about that in just a second. in the room, we have a little bit of information about the benefits of massage. And for me, my personal story with it is I was in the Army at one point in time, and I ended up getting injured. During basic training, I got stabbed in the sciatic nerve region with a needle, went through basic training with a fractured foot, and served 2 years active duty at Fort Drum. Needless to say, I ended up on a walker and wheelchair for about 5 years of my life. 7 different medications. They diagnosed it as severe fibromyalgia. And if anybody knows anything about the VA, they do not pay for fibromyalgia, but they do pay me for fibromyalgia. Within that process, I was trying to raise my son these first 5 years of his life, and I was tired of being on 7 different medications and not having any quality of life. So I turned back over to Eastern medicine, which I had heard a lot about, and I had some experience in energies working, as I now currently have 17 years of experience in energy healing, and I am only 33 years old, so it kind of tells you about how long ago I got started. Working in both of them, getting maintenance massage, about 2 one-hour massages a month. I now walk today. I'm off the walker and wheelchair, and I'm currently off of all my medications. I was stationed down here at one point in time. I did airborne training down here. No, I did not jump. I learned earlier that my disability at the point was probably not an ideal situation to be jumping out of a plane. So putting 2 and 2 together, I chose not to. I got my master's degree through it all. I'm currently working on my doctorate in corporate psychology, and I decided to start this company to give back to the community. We offer many holistic methods of helping people become healthier. You don't just have to be sick to be able to go to holistic medicine. You can use holistic medicine at any point in time in your life just to become a healthier person. In holistic medicine, we deal with the mind, body, and the spirit. I have 1 minute left, and there's 2 things I want to share with you before I do that. We have currently gotten with a company called It Works, and these are our massage wraps, which help people who have stuff like strokes or people who can't make it to the gym, people who have fibromyalgia. This helps people be able to lose weight through a wrap program, and it's non-invasive. The other thing I wanted to share with you was that, with the energy stuff that I do, a lot of people are like, well, how do I know I can trust this? And I've brought it to the point where I've gone back and studied a lot of ancient stuff, pendulums that came from Egypt, the other forms of holistic medicine. And you can actually see me working within the energy. Can you hold the microphone for me? Okay. So if I'm not working in energy, the pendulum stays still. But this here is Reiki energy. And if I'm going to manipulate the energy, it's going to turn this way. Or if I want to manipulate the other way, it goes back the other way.
Thank you for watching Unity with Pam. If you would like to be a sponsor, please contact us or visit unitywithpam.org. Production for Unity with Pam is provided by At Motion Media Incorporated. Always show love in the community.